Recognizing complex PTSD in a child. Imagine a child sitting quietly in a classroom. They're not disruptive. They're not asking for attention. They do look fine. But inside, their heart is racing. Their body is bracing for danger that isn't there. To the outside world, this child might look shy, distracted, or even difficult. But what if what you're seeing is actually a nervous system shaped by trauma? What if that child is living with complex post-traumatic stress disorder? My name is 𝗤𝗂𝗪𝗂𝗍, licensed clinical social worker. Welcome to my YouTube channel. Most people associate trauma in children with obvious events, abuse, violence, or disasters. But complex trauma is different. It often comes from repeated experiences, chronic emotional, sexual, physical, verbal, and neglect. Unpredictable caregivers, psychological manipulation, or growing up in an environment where safety was never guaranteed, or parents were narcissists. Unlike the post-traumatic stress disorder, which may follow a single traumatic event, complex trauma develops through long-term exposure to relational stress, especially during early brain development. And here's the challenge. Children rarely have the words to say, "I'm traumatized." Instead, their brain and body speaks for them. Research in developmental psychology and neuroscience has shown that chronic childhood stress can reshape how a child's nervous system functions. When a child experiences repeated fear or instability, their brain's threat detection system, particularly the amygdala, can become hyperactivated, which means the child may live in a constant state of hypervigilance. You might notice signs like extreme sensitivity to criticism or raised voices. Noise is another trigger. Sudden emotional shutdown or disassociation. Frequent nightmares or sleep disturbances. Difficulty concentrating in school. Explosive reactions that seem disproportionate to the situation. A tendency to either cling to adults or avoid them completely. And at the same time, the areas of the brain responsible for emotional regulation, like the prefrontal cortex, may struggle to develop fully under chronic stress. So when the child reacts intensely, it's not defiance, it's survival, it's physiology. Their nervous system has learned a very simple rule, and that is stay alert, stay guarded. Danger would come at any moment. Some children respond by becoming aggressive, and some children disappear in silence. But both patterns often reflect the same underlying process, a developing brain adapting to prolonged emotional threat, or even a physical threat. So recognizing complex PTSD in children isn't about labeling them. It's about listening differently, because sometimes the problem child is actually a traumatized child. And research shows something profoundly hopeful. When children experience consistent safety, emotional attunement, and supportive relationships, the brain can begin to heal. Neural pathways can recognize, trust can be rebuilt, and the nervous system can slowly relearn what safety feels like. So the next time a child seems distant, reactive, or withdrawn, pause before asking, "What's wrong with this child?" Instead, ask the question. Trauma-informed care begins with, what happened to this child, and how can we help them feel safe again? Because sometimes the most powerful intervention in a child's life is simply an adult who learns to see the signs and not to react or shame the child, but instead express a lot of love, understanding, empathy, and a safe environment. Thank you for watching my video, and if you liked it, please subscribe to my channel, hit the like button, and leave a comment for me. Thank you so much.